September is National Cholesterol Education Month, a good moment to take stock of how you're doing and what you can improve. Dr. Michael Blaha from Johns Hopkins Hospital is here to discuss. Doctor, thanks for joining us.
Yeah, my pleasure.
So something that people may not think about every day is that high cholesterol is actually linked to heart disease. Can you explain that connection?
Yeah, there's a very tight connection, scientifically proven and rock solid, and it's evidence-based that higher bad cholesterol, so-called LDL cholesterol, is directly linked to development of atherosclerotic cardiovascular disease. And that means atherosclerosis building up in the blood vessels and risk of heart attack or stroke. That's why we want to lower cholesterol as early in life as possible to lower that risk of cardiovascular disease later on.
And how can a patient actually tell if they have high cholesterol?
It's a great question. They can't feel high cholesterol, and just like they can't feel the daily fluctuations in blood pressure for the most part. So you have to rely on a test, and you have to get your cholesterol checked to know if you have high cholesterol. And many patients have never had their cholesterol checked, and we know that certain patients have extraordinarily high cholesterol that puts them at very high risk. So all adults over the age of 20 should have their cholesterol checked at some point using either a fasting or non-fasting specimen just to see what their cholesterol looks like and to check out their so-called LDL bad cholesterol and their triglycerides, their blood fats, both of which put people at higher risk.
Well, and just like many other things in our lives, this is something that, if it's not great, can be improved, but it has to be managed. So what can people do to do that, to manage their high cholesterol?
That's right. Just about everyone could manage to have lower cholesterol. The lower, the better, as they say. And that can be achieved in some patients with diet and exercise alone. It's prudent diet with a lower saturated fat intake, more healthy oils and fresh fruits and vegetables and fiber, or vigorous activity. But it turns out if you have high cholesterol and you're at high risk, you're going to need a medication to further lower the cholesterol. And all guidelines point to the statin class of medications as the bedrock therapy for cholesterol because they lower cholesterol in a potent way, but they also lower cardiovascular events. So we always start with the statins, and there's multiple different statins within the class. So almost everyone can find a statin that works for them and stay within that proven class of medications.
Well, and it's important to stay consistent with that medicine, right? So what are the dangers if someone decides to suddenly stop taking it?
Yeah, this happens all the time. In fact, the data would support that 50% of patients who are taking statins just for cholesterol would sort of taper off after a year and stop taking it as frequently or stop. And that's very dangerous. In fact, we know from the evidence that if you stop your statin, you no longer get the benefit and your risk will go back up again. So you have to talk to your physician about any concerns that you have or misunderstandings. And your physician can recommend maybe a different statin if you're uncomfortable with the first statin, perhaps one that's processed in the body differently, like Livalo, for example. I'm here with KOWA Pharmaceuticals America today, who makes Livalo, which is another statin option as we think about cholesterol treatment. So there's almost always a way to find a drug, a statin drug, to get on to lower the cholesterol and lower risk, whether that's Livalo or another medication. But the statins are what's important.
Got it. So if people want to learn more, doctor, where can they go?
Yeah, I'd point them to the American Heart Association to learn more about heart disease risk and that link with cholesterol, so important. LivaloRx.com is a place to learn about Livalo. Also, just talk to your physician and make sure you get your cholesterol checked and talk to your physician about it so you can put together your cholesterol and your risk and figure out the best treatment plan. And certainly talk to your physician if you're having any questions about a statin that had been prescribed for you in the past.
Very good. Dr. Michael Blaha, thanks for your time.
My pleasure.